Hi, I'm Colden, and for this video I'll be talking about the requirement 4A for the Tenderfoot rank. The list of things that you'll need to learn about are snake bites, spider and insect bites, and stings. First degree burns, sunburns, blisters, frostbite, choking, nosebleeds, and simple cuts and scrapes. I grouped these into small groups that you'll be able to skip around the video to find which ones you want to learn more about. But first, we need to learn about the first aid method. There's 8 steps to this. The first step is check the scene. Second is call for help. Third is approach safely. Fourth is provide urgent treatment. The fifth one is prevent further injury. The sixth one is make or treat for shock. The seventh one is make a more thorough examination. And the eighth one is plan for a course of action.
Step 1. Check the scene. Before doing anything, stop for a moment to look over the entire scene and collect your thoughts. Consider the following questions. What caused the illness or accident? Are there dangers in the area that could affect the victim, bystanders, or rescuers? Should the victim be moved? How many victims are there? How badly are they injured? Which ones appear to need the most assistance? If other people are nearby, can they assist with first aid or getting help? Will the bystanders need guidance so that they do not become victims themselves? Step number 2. Call for help. Whenever someone has anything more than a minor illness or injury, act quickly to get them medical help. Send a bystander or first aider to call for help immediately. In much of the United States, you can dial 911 to reach emergency services. Some communities use other special alert procedures, such as dialing 0 or calling the local sheriff's office or fire department. Step number 3. Approach safely. Keep your own safety in mind. At the scene of a car accident, watch out for other cars and trucks on the road. In the backcountry, be aware of falling rocks, slippery footings, steep slopes, and other hazards. As you approach the victim, be aware of your surroundings. Step number 4. Provide urgent treatment. Any situation where a victim requires urgent treatment is considered a hurry case. Bleeding and breathing are the immediate concerns. When you approach an ill or injured person, take 15 to 20 seconds to survey the victim's condition to find out the following. Is the person conscious? Is the person breathing? Is the person's heart beating? Is there severe bleeding? Are there other contributing factors like allergies, diabetes, or other possible causes of an emergency situation? Is there evidence of pills, chemicals, or other poisons? Based on your discovery, provide an urgent treatment that the person needs. Step number 5. Prevent further injury. Avoid moving someone who is injured unless it is impossible to perform urgent first aid on the victim in the dangerous location. If the person's position must be adjusted, do so carefully with minimum amount of movement. With the help of a fellow first aider or bystander, stabilize the victim's head and neck as you move the person. Never move a person with a suspected spinal injury unless it's absolutely necessary. Treat for shock. When a person is injured and under great stress, the circulatory system might not provide enough blood and oxygen to the body tissue. This condition is called shock. It requires quick and effective treatment. Every accident victim should be assessed for shock and immediate treatment if necessary. Step number 7. Make a more thorough examination. When professional medical help will be delayed, check the victim from head to toe for other injuries after providing urgent care. If the victim is alert, ask for information about how the injury occurred. Ask what hurts and whether the victim can move arms, legs, fingers, and toes. Pay attention to how a victim is responding, as well as to what he or she is saying. Open rain gear, jackets, and outer clothing that might be hiding other wounds. If you suspect a spinal injury, avoid moving the victim as much as possible, but carefully check any parts of the body that aren't visible but might be injured. The information you collect during this examination will be used to plan a course of action. Step number 8. Plan a course of action. If medical assistance is on the way, keep the victim comfortable. When help will be delayed, decide on a clear course of action. A victim can walk alone or with some support might be able to hike to a road. If injuries are serious, it is almost always better to send two people to get medical help. Keep monitoring the injured person's condition and be ready to respond to any changes.
For this video, we'll be demonstrating a venomous snake bite. There's also non-venomous snake bites, which you'll do the exact same things, except you'll not have the arm elevated to the same level as the heart. First, rinse the wound with soap and water. This will remove any debris from the area and try and remove blood also. Next, dab off the area with a paper towel or rag to remove all the excess water before putting on the antibiotic ointment. After that, put a pad on top of that. This will prevent the wound from oozing into the gauze wrap, which would rip off the wound after you took it off. To start the wrap, leave a little bit extra at the beginning because you'll later use this to tie off too. Continue in X motion until you are out of the wrap. A saying to remember which snakes are venomous and non-venomous are, red on black is friend to Jack, and yellow on red can kill a fellow. Anytime you are dealing with venomous snake bites, always call 911 or poison control, because they can tell you more information on what to do and help you identify the snake that bit you. At the end of the wrap, tie a bow or a square knot to prevent the gauze from unraveling. The bites and stings of ticks, chitters, spiders, insects can be very painful sometimes. Some might cause infection, so protect yourself from bites and stings by wearing long pants and long sleeve shirts whenever you are in woodlands and in fields that might be infested. Button your collar and tuck your pant cuffs into your boots or socks. Insect repellent also can be effective. Inspect yourself daily, preferably the hairy parts of your body because that's where they prefer to live. The first steps for a nosebleed is first, place a rag under the nose. Next, have the person pinch their nose, and then you add a cold compress on top. Next, have them tilt down their head. You should continue this until the bleeding stops. If the bleeding lasts for more than 15 minutes, you should call for help. Small cuts and scrapes and other openings in the skin can allow bacteria to enter the body and cause infection. Wash scrapes and minor cuts with soap and water. Ask about any allergies because you don't want to use any ointment or cream that can cause more infection to the person. Make sure you are always wearing gloves when working with any blood. After you are done washing, dab off the area with a paper towel or rag just to get rid of all the excess water. Next, put any antibacterial ointment onto the wound and then open up a band-aid and put it on the site. Make sure never to touch the pad on the inside of the band-aid because this can just spread more infection. Make sure you always put a new band-aid on every day or so to keep the wound clean. You should also wash it constantly to get rid of all the new bacteria that might have grown. The first steps for a first-degree burn or sunburn is to use lukewarm water to rinse the wound. This is to cool down the wound so that the person doesn't feel a ton of pain. If you use too cold or too warm of water, this can just scald the tissue and cause the victim more pain. After you're done running water, you should take a dry paper towel or rag and pat down the wound. Make sure not to rub the wound because that can just cause more pain for the victim and rip off tissue. Next, you should take some aloe vera gel and put a little bit on the site of the burn. Next, gently rub in the aloe vera gel and try not to do this too vigorously because you can still rip off skin if it's too severe. Try and get an even coating of the whole site of the burn. To prevent sunburns, use sunscreen with a protective factor of at least 30 FPS. To prevent blisters on your feet when hiking, wear shoes or boots that will fit well and have been broken in. Change your socks if they become sweaty or wet. If you do develop a blister, try not to pop it. Breaking a blister increases the chances of infection by bacteria. Instead, cover the tender area with a piece of moleskin or mole form. slightly larger than the affected area. Pay attention to how your feet feel. A hot spot is an area of skin that becomes tender as a blister starts to form. If this starts to happen, take a rest and place a piece of moleskin over the hot spot. Now to frostbite. Frostbite occurs when the skin and tissue becomes cold enough to freeze. A frostbite victim might complain that the ears, nose, fingers, or feet hurt or have become numb. Sometimes, though, a victim of frostbite will not notice anything unusual. Grayish-white patches of skin are warning signs that ice crystals are beginning to form. Treat frostbite by moving the victim into a shelter, such as a tent or building. When an ear or cheek is affected, remove a glove and warm the injury with the palm of your hand. Slip a frostbite hand under your clothes and against warm skin if you suspect that. Frostbite is severe. Help the person get into dry clothing, wrap the injured area in a blanket, and get to a doctor as soon as possible. Do not rub a frostbitten limb with your hand or with snow. Do not attempt to rewarm by placing the affected part next to a fire or a dry heater. This may cause further damage by burning the tissue. Okay. The first steps to this is first you have to identify that the person is choking by his hands being around his throat. Next, you have to bend them over and apply 5 back blows between the 2 shoulder blades. Next, make a fist and put your thumb on the outside, and then put this just below the belly button and do 5 upwards thrusts. Repeat this and do 5 back blows. Continue these steps until the person spits out the item or passes out, which then you'll have to start CPR.